With an increase in respiratory infections across the province, BC's top doctor is bringing back a mandate for healthcare settings starting Tuesday.
Medical masking will become a requirement again, continuing medical masking by healthcare workers, visitors, contractors, volunteers in patient care areas.
During an update on Thursday, Dr. Bonnie Henry said masking won't be required for patients, clients, or residents unless directed by a healthcare worker. In long-term care homes, medical masks will be required in indoor common areas, but won't be when visiting with a resident in their room or an assisted living unit.
To be honest, none of us totally love wearing a mask all the time, but it's what we do as healthcare professionals. We help protect patients. We help protect the patients who are most vulnerable, who are elderly, who are at risk. And so I think we will support this, although we wish we didn't have to.
Certainly a question we have is, ensuring that there is actually, good supply of masks, both for the public, but also the healthcare setting. Certainly, earlier in the beginning of the pandemic, that was a significant concern. There was not enough personal protective equipment to keep nurses safe.
The province says the fall rollout of updated vaccines will also begin next week, with priority groups such as those 65 and older and who are at high risk of severe illness. Everyone else can book their immunizations starting October 10th. Residents can get their COVID and flu shots together. On Thursday, Health Canada approved the updated Pfizer vaccine for the Omicron subvariant.
The message today is pretty clear. We need and we want everyone, when they're invited to do so, to get vaccinated. It's important for influenza. It's important for COVID-19.
In early April, Dr. Bonnie Henry lifted masking requirements in healthcare settings, but she says it's being reinstated to slow down the impact of viruses.
Expect to wear a mask if you're in a hospital or a healthcare setting in the next few months, and that's the best we can do to protect each other.
With the anticipation of increased illnesses during the respiratory season, the province says plans are also in place to add more hospital beds across the province. In Vancouver, Kate Walker, City News.